Good afternoon, Santa Clarita. You're joining us here on the Providence Holy Cross Health Hour on KHTS, 1220 AM, 98.1 FM. If you're confused, look behind me on Facebook Live. Thank you for joining us there as well. You'll find the stations there. And just in case, if you're not in the Santa Clarita area, remember to make sure you pick up the KHTS app. You can get it for your Android, get it for your iPhone. Very easy to use and allows you to get KHTS not only outside of Santa Clarita, but anywhere in the world. So really recommend, so that way you can catch up with what's going on with Providence, what's going on with Santa Clarita. Make sure that you pick that one up because it's going to make life that much easier and much more enjoyable. So here we are today. It is a beautiful day in Santa Clarita. Really glad to get out of the office, and we'll get to our guests. However, this one's very special because we have all known each other for a few years. So just a few. So cannot be any happier, and it's with great news. Again, of course, it's with Providence and with Holy Cross. It is going to be great news. The harsh thing is you take a look and you go, Holy Cross, but that's in the Valley. And we are in the Valley, but, with 30% of our patients coming from the Santa Clarita Valley, more than 30% of our employees living in Santa Clarita, all of a sudden it seems to make an awful lot of sense that Holy Cross really should make their presence known out in the Santa Clarita Valley as well. And we really have. You really can't go too far in Santa Clarita without seeing something that we are a part of, whether it be the beautiful building, which we're going to talk about over on Valencia and McBean, the Holy Cross Plaza there. It could also be Facey, which is throughout Santa Clarita. It could be Exer over in Stevenson Ranch. We are affiliated with City of Hope, Children's Hospital. We're pretty much everywhere. And we're so jazzed because also our Providence Medical Institute, which is a variety of our physicians associated with Providence, where our specialists are doing some tremendous work. Our neurosurgeons, our GI docs. We've got a new PM&R coming on, which is physical medicine and rehab, or a physiatrist. We've got a whole slew of new physicians coming through. Now, we're going to talk about that next month, where our guests are going to be Doug Ziegler and Maria Townsend, who is part of our business development group that allow us to continue to grow and continue to shine, bringing on some of the best providers that we can possibly have, not only in the city, but also in the state, as well as the nation. So we are just kicking some butt. Recently, we had a fantastic foundation event back in August, where the Providence and the SCV, and we do encourage everyone, if you're really interested in seeing what happens and how you might be able to contribute to Providence Holy Cross Medical Centers in our endeavors in growth, whether it be assisting with events, if you kind donation, anything. We would love to hear from you. Contact our foundation. You can reach that calling the 818-365-8051, and they'll be able to put you in touch with the right people in our foundation so that you can become a part of the Providence and the SCV. Our last event was fantastic. We were looking at the variety of ways we're going to be able to grow our neonatal ICU. And we've had a number of speakers, which was extremely exciting, and we cannot be any more thankful than Jerry and Carl of KHTS. They hosted us at their beautiful home, and as well as it had to have been 90 people, give or take, and it was a great event. And we just continue to gain more membership and more interest in what we're doing at Holy Cross, which is exciting. But while we were talking during that event, our CEO Bernie Klein, Dr. Bernie Klein, presented some just general stats, and I want to read these off to you because it's very interesting to me about how good we actually are, and it's really not bragging if all you're doing is repeating the facts. So let's just go ahead and talk about it. So magnet status. So 7% of hospitals in the United States are magnet status hospitals. That means we carry a much higher level for our nursing staff, which means we're going to have better outcomes. And we're not just new at magnet. I believe we've gotten, this is our third go through where we've been certified as Magnet. We're one of the top 100 hospitals overall in clinical care, according to health grades, which anytime you look up anything health grades for medical, health grades is one of the things that we'll be looking at how we would be scored. Top 150 places to work in healthcare for the third year in a row per Becker's. Now that's important because Becker's is a go-to publication for a variety of different aspects, whether it be ASCs or hospitals or however, which is just an honor for that. And then we were also voted top 20 best regional hospitals for the greater LA area for the third year in a row as well. So we're doing a great job, and we continue to grow. We continue to meet the mark and exceed the mark. And, you know, we had an amazing stat that came up during one of our big leadership meetings, and that last year, we had 110,000 ER visits, all right? So I did the math, all right, and I'm LA Unified, so I'm pretty sure the math is pretty close to correct. That's over 300 patients per day coming through our emergency room, which is astounding to be able to see that and to be able to continue to care this small little community hospital, all right? And Sandy, we started as a community hospital, and now we are a regional hospital, trauma center. It's amazing on how much this has grown and astounding. Back in the day when we were with the Sisters of the Holy Cross, we joined the Providence family, now 51 hospitals strong. Providence Health System, we recently went together, created a partnership and with St. Joseph's Health System down in Orange County in Texas. We've got an enormous health system that we're able to be able to derive off of all this wonderful information. Our top-notch specialists, and we're actually driving how healthcare is going to be looking 5 years, 10 years down the line, which is really exciting. And, you know, I don't want to talk about 5 or 10 years down the line because we're going to start talking about now, okay, or in the next couple of months. There's something exciting going to be happening that's going to up here in Santa Clarita, and Holy Cross with their Oncology Rehab is coming back. Is that right? Now, Sandy Gravitt. So who's in the? Okay, so if you're looking at the screen to my right, Sandy Gravitt, Joanna, Shanazi. We have been with Holy Cross for a few years, and I'm so jazzed that we're doing this. So, Sandy, I'm going to let you introduce yourself.
All right.
And what I want to know is also, now I know you're a physical therapist. What got you to do this? What got you into therapy and the such, as well as what you do now?
Okay, well, thank you, Tom. I am a physical therapist. I've been a physical therapist 38 years, and 31 of those years I have been at Holy Cross. So it just lets you know that what a great place it is to work and how fulfilling it is. And Joanne has also, we started the same year, so we've both been there for 31 years. And what got me into physical therapy was just the love of the biological and physical sciences, and how to also do something to give back to the community and to people and to serve them. And it's just a field that I'm still very passionate about, and it's just been a very rewarding field to be in.
And you've done the continuum. You've done the inpatient, or what we call acute care,
Yes.
Working with patients in the hospital. I mean, we work together in the outpatient arena.
Correct.
And now you are...
I am the director of the Rehab Services Department, and that means I oversee physical therapy, occupational therapy, and speech and language pathology. And we have one recreational therapist as well. And our continuum includes not just the hospital, but our outpatient department. We have a subacute unit where we provide services, and we have an inpatient acute rehab unit where we provide services as well.
That's great. And now I know today we're going to be talking somewhat about the outpatient, but the outpatient at the hospital, you know, it's so funny because the outpatient itself, normally you assume it to be private practice or however, but a hospital-based outpatient program is a very interesting idea because it and the way that we staff, we actually can spend a little bit more time face-to-face, one-on-one with our patients, and that's in a variety of different ways. Tell us about the different outpatient services that might be available.
So we have programs all over the map. We have orthopedic and sports injury rehabilitation. We have a neurological rehabilitation for a variety of neurological disorders. We also have vestibular rehab. We have hand therapy. We have several therapists that are certified in specialties such as hand therapy. We have, which we'll be talking about today, is our oncology lymphedema program and rehabilitation. We also have women's health, and we have pelvic floor, not just for pelvic floor rehab, not just for the women, but also for men as well. We have swallowing therapy, which includes things such as it's called Vital Stim, but it's an electrical assistance for swallowing. We provide barium swallow studies. We have cognitive rehabilitation, voice therapy, and we even have neonatal rehab, particularly since the hospital has a neonatal intensive care unit. So we're really across the map.
It's everything.
Right.
There's not a whole lot that we can't actually take care of.
Correct.
And the nice part of it is that the parking's pretty convenient.
Parking's very close and convenient, which is a nice, a very nice thing, especially for our patients, because we some have limitations.
And for a hospital period.
Yeah, correct.
So extremely exciting to hear that, and then within your role, then you're kind of overseeing all of that.
That's right. That's right. And as you mentioned, we do pride ourselves in the amount of time we have one-on-one therapy with the therapist. You get the same therapist, each visit in the outpatient arena, and where we can spend 45 to 60 minutes, with individualized therapy, and that's what we really pride ourselves in.
And that type of consistency too, specifically, I really appreciate the idea of having it being with the same therapist, because that actually is that patient-therapist relationship is actually a very strong one, and as that consistency with care, there's no reviewing; it's moving forward with each visit, and it seems to be a lot more efficient in that way, and just the way that we see therapies going, where you seem to spend a very little bit amount of time with your therapist and a lot of time sitting in a gym going through exercises. To be able to have that time one-on-one with your physical therapist is invaluable.
That's right, and we find that the individualized therapy and continual therapy, it just really leads to better quality, and it gives us an opportunity not just to meet the physical needs of the patient, but we get to know the patient, so we can also address and or provide resources for other emotional needs, social needs. The hospital has those resources, even spiritual needs, because the hospital has those resources. Of
course, and I know we're going to get to support groups, but Joanne, now with your role, and you've done you've worn a couple of different hats over at Holy Cross, so Joanne Shanazi, lymphedema extraordinaire, therapist extraordinaire. You started though as a practicing occupational therapist. Take it from there.
So I've been an occupational therapist for 33 years now, graduated from Loma Linda University, spent my first 10 years floating from acute care and outpatient hand therapy, and then 23 years as a certified lymphedema therapist, with 2 extra certifications in lymphedema management, ICLM certified, International Certification of Lymphedema Management, and LANA certified Lymphology Association of North America. And I just have a passion for what I do, and ended up in lymphedema and oncology, and just thoroughly enjoy it.
Now, I remember when you first started, and there really wasn't a lot of knowledge about this, and it was across the board with everybody. The physicians weren't I think it was recognized, but they weren't so sure. The role of the therapist in this, they weren't entirely too sure. Who's appropriate, nobody was really quite too sure. But now all of a sudden, it seems to be a lot more structured. I think probably one of the better parts to maybe start is, what's lymphedema?
So lymphedema is a condition of the lymphatic system that results from obstruction or disruption of the flow of lymphatic fluid. Disturbance of the flow leads to the accumulation of protein-rich fluid in the interstitial tissues, resulting in swelling of the affected body part. The resulting swelling can range from mild to severe, and when left untreated, can lead to skin changes, impaired function, loss of normal sensation, pain and discomfort, wounds, infections that affect the quality of life. Lymphedema is classified as primary or secondary. Primary is the congenital dysfunction or abnormality of the lymphatic system. Secondary lymphedema results in obstruction or disruption of the normal lymph flow because of tumors or damage to the lymphatic channels. And this is the most commonly result from surgery, radiation therapy, trauma, or infection.
Right. Now the having worked side by side with Joanne and with Sandy, we've had the opportunity to see that lymphedema, it may not be that obvious, and it's very interesting because when you start talking about the lymphatic system, I'm going to go ahead and reference that you cannot watch a sport now without seeing somebody who has kinesiotape on. And the kinesiotape, oftentimes, especially when you see the one that looks almost like it's got tentacles all over the place, we actually call them squids. That oftentimes the reason we apply those is to try to create space for lymphatic channels to allow for the drainage of fluid that normally occurs, whether it be with injury or however. So, oftentimes when you're watching TV and you're watching some of these sporting events, when you start seeing K-tape, the kinesiotape on those athletes, especially the ones that look like tentacles, a lot of the times they're working on trying to open lymphatic channels to allow for appropriate drainage, which is going to allow for better health of the limb itself, better function within the limb. But yeah, there are times where maybe things will occur where those lymphatic channels might get blocked. Let's kind of talk about a few of those things that we might actually see.
So it can be the result of trauma in the normal person, from sports injuries, like you had managed to say. The kinesiotaping is a quick way to facilitate some local fluid collection. But however, in the oncology group, it's just a little more complicated. These patients have typically had cancer surgeries where there is the removal of the tumor as well as the lymph nodes, followed by radiation to the lymph node bed, which compromises the function of the lymph nodes, which are like biological filtering stations for the lymph, which is body's waste fluids. So these patients tend to not have more localized swelling per se, but mostly more diffuse swelling in the arm or the breast if they're breast cancer patients. If they're pelvic cancer survivors, it's mostly in the legs. It's not uncommon to see swelling in the head and neck from oral cancers and so on.
So now, I'm going to throw an analogy out there that mostly Santa Clarita residents who drive the 5 will understand. When you take away 2 lanes, there's a backup of traffic, okay? And we're experiencing this on a regular basis over the last 3 years, is that a lot of the times these channels, when they remove nodes, can actually close. It's almost like a bottleneck, and that the number of cars trying to get through is going to will be much overdone than what the freeway can actually tolerate, and you get a backup. And it's the same thing happens with lymphedema.
Yes, however, there is hope.
Yes.
There is hope, and that's why I'm here to share that good news. And so it doesn't necessarily need to be bad news.
Right.
A lot of these cancer survivors have already had bad news, and having lymphedema could be, a pretty devastating secondary complication to your cancer treatments. But I'm here to say we know what lymphedema is, and we know how to treat it, and treat it well. So just like Tom was talking about these channels being blocked, good news. We are wired with accessory drainage pathways in our body that we as lymphedema therapists can use to move these blocked lymphatic pathways into other alternative drainage pathways for drainage.
That is the best news, and we're going to be taking a small break. We're going to come back to that. You're joining us here on the Providence Holy Cross Health Hour. You're with Joanna, Shanazi, and Sandy Gravitt. You're with Tom Burton on KHTS, 1220 a.m. We'll be right back.
Santa Clarita Philharmonic has begun its season of free concerts. The SCP is a non-profit community-based volunteer symphony orchestra comprised of local musicians from throughout the Santa Clarita Valley who are dedicated to providing quality classical music for the residents of the Santa Clarita Valley. Like the Santa Clarita Philharmonic on Facebook or visit santaclaritaphilharmonic.org for more information.
Olive Terrace Bar and Grill is the hottest new Mediterranean fusion restaurant in Santa Clarita with unique delicacies like seafood right off the boat, mouth-watering prime steaks, artesian sandwiches, delicious pastas, and tasty kebabs. Unwind on their cozy outdoor patio at their weekend champagne brunch, full menu, and weekly specials at oliveterracebarandgrill.com. Check out their full bar and happy hour daily specials in Valencia on Copper Hill and Newhall Ranch Road by LA Fitness. Olive Terrace Bar and Grill, delicious food seasoned with love.
I've always been driven to serve our country and our community.
Congressman Steve Knight.
I served in the United States Army and spent 18 years as an officer with the Los Angeles Police Department. I ran for Congress because too often I saw people forgotten by Washington. The crisis at the VA exemplified a bureaucracy that was out of touch and hurting real people. As your congressman, I'm committed to making our government in Washington work better for you.
My name is David Brayton. I am an Air Force veteran. 10 years ago, my doctors told me that I had to have a double lung transplant. It was a massive uphill battle to get the VA to do what they said they were going to do in the first place. Finally, Steve Knight got involved, and if it wasn't for Steve Knight's assistance in this thing, I guarantee you I'd be dead. Steve Knight is a veteran, and he's LAPD on top of it. I'm voting for Steve Knight because he gets stuff done for us.
I'm Steve Knight, and I approve this message.
The Santa Clarita Artists Association is hosting our annual gala, the Art Classic, Saturday, September 29th from 1:30 to 5 p.m. This fundraiser highlights professionally judged original artwork by local artists in all mediums. For only $25, you can enjoy live music, wine, hors d'oeuvres, and meet the artists in person. The Art Classic will be held at Hart Hall in Hart Park. All artwork will be on display for free public viewing Sunday, September 30th from 10 a.m. to 4 p.m. For tickets and more information, visit us at santaclaritaartists.org.
Your hometown station.
KHTS AM 1220 and the new 98.1 FM.
Doctor, give me the news. I've got a bad case of loving you.
And good afternoon, Santa Cruz. Welcome back. You're joining us after our break here with the Providence Holy Cross Health Hour. We're joined today in studio with not just friends and colleagues of mine back from our rehab days, Joanna, Shanazi, and Sandy Gravitt. And we are talking about Oncology Rehab, and there's a reason why they're up here, but we're going to get to that. We were just, before we hit to the break, we were talking about lymphedema, while we were off on commercial, we were just kind of chatting that there are incidences where we would anticipate where these things, where lymphedema and issues may occur. There are some specific stats, Joanne, that you have that really kind of bring that point home. Can you share with that?
Yes, I'll be happy to, Tom. Of the 2.4 million breast cancer survivors in the U.S., 22 to 66% are likely to develop lymphedema within 2 to 11 years. This is clearly documented in some studies. Post-breast cancer lymphedema, the incidence increases from 12 to 30% to 60 from 12 to 30% in 60 months. That's another documented study. The incidence of lymphedema after a sentinel lymph node biopsy, just one taken out, is 69.7%. Axillary lymph node dissection, 69.3%. And according to another study, 1 to 9 lymph nodes excised had a 19.8% risk for lymphedema. 10 plus lymph nodes excised had a 41.3% risk for lymphedema. So these stats go on to also include a little more detail. For those with positive lymph node status, had a 26.2% risk for developing lymphedema after 3 years, and those with negative lymph nodes, 17.9% risk for developing it. So pretty much the risk is there whether you've had one lymph node taken out, many lymph node taken out, negative lymph node status, or positive lymph node status. The risk is essentially lifetime, I'm here to say, and that's one of the mysteries that it kind of gets people uncertain as to if they're a 10-year survivor post-breast cancer, no swelling has happened, and maybe they're clear and free, but the risk is essentially lifetime because the anatomy of the lymph is pretty much changed. But again, we can help that if there is swelling.
That's so important, I think, to be able to drive home. One is we know that there is a probability, and a good probability, that after surgery, especially if there are lymph nodes involved, whether it be just for looking, even if they're clear, that because that is a channel, that is something that that fluid will have to move through, and if you remove that, then there will be eventually a good chance there will be some fluid backup, and there may be a level of lymphedema that may occur sometime in the future.
Yes. So here's something that, sorry to jump
in.
No,
jump in, please.
But there is something called the latency phase of lymphedema, and that's kind of like a phase, an earliest phase of lymphedema where there's not any noticeable changes in the limb with swelling yet. So the thing about the lymphatic system is that it can sense a potential clog in its system, and it can rev up its transport capacity up to 10 times its normal flow rate.
Wow.
And it can do so for quite a long time, and it could be even years. But it can only do so for so long before something happens, typically a triggering activity, or not, or just aging, before this fluid starts to build up in the affected extremity.
Before it just gets before the system gets overwhelmed. Right,
Mm-hmm.
right. And so that's so interesting. So it's something that our bodies are amazing. I mean, we can accommodate, and we have backup systems that will help ameliorate problems for a period of time. But yeah, if the system gets overwhelmed, that can be an issue. Now, as we start looking at this, causatively, we know that can be with nodes, and it's not a question was something done correctly or incorrectly. It's because we're affecting the actual system itself.
Yes, and so the lymphatic anatomy is permanently altered in the cancer patients with lymph node dissection or radiation. Even in the absence of a lymph node taken out, if there is radiation, typically if lymph nodes are targeted, it's a way to render these lymph nodes not really working like they normally should, so they will become sluggish or not operable at all. So the same thing can happen, and the thing with latency stage is that quite a lot of people just don't know they're walking around in latency stage and at risk for the lymphedema.
Sandy, you were just going to say. Oh, it looked like you want to jump in.
No, sorry.
No, that's okay. So I guess my question would be then is it would almost seem to be reasonable then if someone goes through a surgery, maybe they have to have lymph nodes removed or however, especially in our oncology population, does it make sense that maybe they should see a lymphedema therapist kind of even before symptoms begin?
That would be awesome. And in a matter of fact, that's quite a bit in practice already. In Europe, that's more common. In the United States, it's catching on quite nicely. What's important to a little bit of advice before going into cancer surgery would be, how about maybe taking some baseline measurements of your limbs? Say if you're a breast cancer patient, you take a tape measure and some key marks down your arms and just take some measurements of your limbs and document it somewhere. Take your weight, make sure that's recorded, maybe ask your surgeon for a pre-op consult with a lymphedema and oncology rehab therapist. There are several factors to consider for the future as an oncology patient. If you're going to be going through surgery and radiation, that needs to be considered, not only lymphedema, but other aspects of cancer survivorship needs to be considered if we catch these early on. Right. See, our goal is to prevent large amounts of lymphedema complications, but also limb dysfunctions, problems with posture. We want to keep people as functional and have a good quality of wellness and survivorship for the rest of your life. You're not just surviving this cancer treatment, but doing it well.
Right, and quality of life, I think, is probably
right. Yes.
the best thing that you actually, that to me really keys in is that if we know, according to the stats, we know that this is going to most likely happen in a number of cases, that we should just jump in. Like you said, if we can do it pre-surgical, wonderful. We can take some measurements, because then post-surgical, we can look at those measurements going forward and go, you know what, we're noticing a little bit of a size difference. Maybe the limb is getting a little bit bigger. Mm-hmm. Why don't we just go ahead and jump in on that ahead of time before you actually get to a point where the swelling does create the secondary issues that we know are extremely common. And I think, tell us about some of those secondary issues that can actually occur.
So some of them could be tightening of the muscles around the area of surgery. I'll use a common example, like in a breast cancer patient. If you've had a mastectomy or partial mastectomy, that those muscles that attach from the shoulder and go across the chest and the breast will be affected and shortened with the scar tissue during your healing period. Those key muscles around the armpit and the shoulder and the chest all work in unison together for doing things like reaching. The shoulder places your hand where you need to work it. So how important is that shoulder, not only for your ability to reach, but also for posture, for movement. If you're driving, if you want to put your purse in the back seat of the car, you have to use your trunk to reach and put your purse in the back. All those muscles are key for function. And so with pre and post oncology rehab, we address preserving the length and function of those muscles. If you're about to go in for surgery, we would advise you certain stretches to do and to keep those tissues lengthened with good blood supply. Keep the function of your shoulder blade and the shoulder. Posture is so key. You can even work on simple posture even when you're recovering from your mastectomy or surgery, sitting in a chair in the recovery room or in your hospital bedroom, in your hospital room. So just key little things are critical in survivorship.
It really, and it's so funny because when you really take a look at the physiology of healing, we start healing the minute the surgery is done. The process has already started. The chemical reactions are already occurring. The cells that come in to help clean things up that eventually will attract those cells that lay collagen down, that all is happening so rapidly in that early phase, while you still have all that wonderful mobility, is a great place to really start keying in on those good positions, the good movement, maintaining a range of motion before things start to really tighten down.
I agree, because those are a lot of these things that Joanne mentioned. They're just not thought about or considered at the time, and you want to do it beforehand instead of afterwards. And sometimes you need the professional, our knowledgeable person to know what to address and what to look at and what to perform.
Yeah, and kind of underestimate prevention is our what we're trying to get out there. We want to minimize the amount of limitations, the amount of secondary complications, the long-term sequelae of these treatments. So, but you can do it well. You can return back to a high state of functioning. We have many patients that go back to being marathon runners and working out successfully in the gym, and going back to being a mother, and different occupations, and hobbies and sports. And so this doesn't have to be a limiting thing. There is, we want to equip people to be able to thrive.
And then there's a lot of different therapies that you're going to do. You know, I know we're going to be going to a break shortly, but let's talk about some of what you actually do in therapy. What should a patient expect if they are coming in for some form of treatment besides a very significant evaluation? But you describe the treating and what should a patient expect?
So this type of treatment is really relaxing. So a lot of cancer survivors don't know what to expect when they come in for a lymphedema and oncology rehab consult and the treatment, but it's really a nice relaxing treatment. So part of the care involves manual lymphatic drainage. It's like a light massage without oils. We'll just gently stretching the skin, moving the fluid to good regional lymph nodes that were not affected in surgery or radiation. And so we're going to just move the fluid gently to those good regional lymph nodes. We will work on muscles and tissue that is shortened or tight or scarred. We work on reducing the scar tissue that is holding down movement of a tissue, say with movement of a limb. We work on stretches to strengthen the affected joint. Sometimes it's not only shortening of tissue, but it's weakness as well. Postural exercises. Sometimes we work with modalities that can assist with scar tissue, like low-level laser has been documented, and to be working quite well with that. If a patient comes in with wounds as a complication, we're able to also assist with their care with that. We don't do the active wound care, but we will work with the wound center, and together, and studies just show that together it's a very successful course of treatment when lymphedema combines with wound care. So we look at also using different materials like compression bandaging or some of the newer semi-rigid compression garments that help reduce limbs. A lot of people can't do the layer-on-layer bandaging, but there is other newer products that the garment manufacturers have put out. That's really exciting. So we work really closely with our compression garment manufacturers. We try to keep up with the latest and best things that have come out, and we're able to offer those to our patients.
Oh, that is great. That is just great. And and I think the piece to really appreciate is that massage itself may not help this problem. In fact, sometimes massage can actually make this problem worse, because technique-wise is that if you put too much pressure, you're going to close the channels. Because it's an open close piece, and that if you work too deeply, and you can cause maybe some I'm going to say trauma. I don't mean it in the sense that something is wrong, but sometimes you can have some soreness after a decent massage, but you can actually have swelling that can actually push on the other side of the lymphatic channel, not just on the surface. And so having that gentle approach, clearing appropriately to allow for that good fluid movement, and great garment use to assist on when the patients aren't with you, and then self-care and self-massage they're going to be able to do, which is so hugely important. But there are complications that can occur that I know there's a big education piece to this too.
Yes,
Tell me a little bit about the education piece.
This is vital. No different, I tell my patients, than going to your dentist. We eat to survive, and so you need to go to your dentist for his care, but he will send you home with a toothbrush and dental floss to do daily care. We are alive, so we make lymphatic fluid. Remember, the lymphatic fluid is part of the body's waste fluid, and so we make this every day. And so if you have the potential for a clog within your lymphatic system, we teach you how to manage this on a daily basis. We will teach you how to do your self-massage, your good skin care, because patients are high risk for infections with these swelling disorders. Remember, the lymphatic system is part of the immune system. So the limb at risk is at high risk for something called it's cellulitis. It's an infection of the skin. So we educate patients how to minimize that risk of infection, wear their compression garments, do their stretches. We kind of we personalize their home treatment program.
Yeah, our treatments are very customized, very individualized, and we're afforded the time and, like we spoke about earlier, the consistency of having the same therapist.
It's so true, and in this population specifically, consistency is going to be everything, because a lot of it is about the message that's being given. That this is something that is manageable, and that we're going to give people the correct tools. What do we need to watch out for? How do you protect your skin? Which is, I remember listening to you talk about it, where, you have to be very careful about, even with going in for manicures or pedicures and things to that extent, where you want to really be very cautious not to cause too much trauma to the skin, and the different adjustments maybe that you may need to make just for safety-wise prior to, during your care, and then afterwards, and then being able to take a look and self-manage and also self-assess.
Yes. So one of the other things, we don't want to be a party pooper. We don't want to tell you that you cannot have pretty nails or look pretty. We just want to make you have educated, smart decisions about your quality of your care on your skin. So like Tom mentioned, we would recommend maybe having your own set of manicure tools. Maybe you can bring that into your manicurist, and things like that. Good skin care is very important. Moisturizing with hypoallergenic skin products is a daily must. Just kind of checking. Now, we don't want to make you paranoid if you're at risk, but just maybe checking in the mirror, getting used to what your body looks like, and then maybe taking a picture every once in a while to see if there's any changes on the side that's affected. If you're a breast cancer patient, you might want to just look in the mirror, bend your elbows, look in the mirror to see if you can still see things like the bones in your elbows, the bones in your forearms, in your hand, when you make a knuckle in the fist, if you can still see your knuckles. Just little things, little quick checks like that when you're already in the bathroom might be just a little quick self-check.
That is perfect. And we're going to find out exactly how we're going to be able to get this care now, which is going to be one of the big reasons why we're here. So when we come back from the break, we're going to go over that. You're with the Providence Holy Cross Health Hour. You're joining Joanna, Shanazi, Sandy Gravitt, Tom Burton. We're here from Holy Cross talking about oncology rehab specific to lymphedema, and we will see you shortly.
Daily Imprints is the premier one-stop shop for custom embroidery, screen printing, and promotional products in the Santa Clarita Valley. Owners Joe and Dana have provided KHTS with quality embroidered company shirts for over 3 years. If it's new business cards or promotional products you need to enhance your image, Daily Imprints is the choice for you. Located on Lyons Avenue, stop by or call today, 661-678-0508.
If you're tired of your nail polish chipping a day or two after an expensive manicure, then you'll love the gel nail polish manicure now offered by Anne. Anne is a licensed manicurist serving the Santa Clarita Valley in Canyon Country for over 15 years. And now she's offering the gel manicure that lasts without chipping for up to 2 weeks. Log on to hometownstation.com for details on how to get an amazing deal on gel nails by Anne on Restaurant Row, or call Anne at 250-8340.
This is a Rita's Daybreak. There's a huge crowd at Rita's. With so many amazing flavors, every day's a treat. Let's see what folks are celebrating.
I lost my first tooth.
No more training wheels.
My dog photo got 37 likes.
3 kids, 3 activities, 0 meltdowns. There you have it. Layer it, blend it, or drink it with Italian ice and creamy custard. So many reasons to celebrate at Rita's. This has been a Rita's Daybreak.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Your hometown station.
KHTS AM 1220. And the new 98.1 FM.
Doctor, give me the news. I've got a bad case of loving you.
And welcome back from the break. You are joining us here on the Providence Holy Cross Health Hour on KHTS AM 1220, AM 98.1 FM. You're catching us on the app. And, you know, if you happen to be watching on Facebook Live, though you can't hear what we're talking about, we almost forgot to bring up one important piece. Joanne, what about shots or blood pressure cuffs and things like that?
Yeah, so we just advise like breast cancer survivors on the side that the lymph nodes was taken out or radiated to avoid having blood pressure on that side, or needle sticks as a precaution, and always offer up your other side. Sometimes we recommend, if for some reason you forget that important bit, just get like a medical alert bracelet, and that would say no BP, no needles on whichever arm that's affected.
Perfect. And I do see that up on the floors every so often as well. And and it's in the big, bright yellow stickers, which is very, very helpful to notice that. So now, Sandy, you have exactly how they're going to contact if they need any type of oncology rehab or any rehab whatsoever. You're going to be able to give us all the contact, where the clinic is located, and then you have some exciting news about out here.
Yes, I do. I definitely do. So to contact us at our main facility at Providence Holy Cross in Mission Hills, the phone number for our department is 818-496-9... wait a minute, 818... 496-4529. Obviously, I don't have to call it often because that's where my office is located, in that building. It is located in the north building on the Providence Holy Cross campus, which is just a single-story building directly, practically touching the hospital. We have, like we mentioned before, we have special parking for our outpatients that has a very minimal distance to walk in order to get us.
And that access is off of Indian Hills Road.
And thank you. Yes, that access is off of Indian Hills Road, so you are avoiding the main parking lot for visitors. And we have, of course, handicapped parking as well.
And now, exciting news for Valencia and the Santa Clarita Valley.
Yes. We are reopening our Oncology Rehab department up here in the Santa Clarita Valley. We did have it several years ago, but now we are reopening. We're very excited, especially hoping, to partner with City of Hope now that they're in Santa Clarita. So this is for Oncology Rehab. It is located in the Facey Providence building on the corner of McBean and Valencia Boulevard. We are embedded within the imaging department on the first floor, but we have our own suite within the imaging department. But still, no matter which facility you want to go to, you do contact the main number at the Mission Hills number.
Okay, so 818-496-4529. If you ever need any type of therapy, speech, occupational therapy, physical therapy, whether it be orthopedic, sports medicine, neurologic, vocal, swallowing, oncology, any type of rehab that you may need to be involved with. And normally they're going to need a prescription, is that right?
They always need a prescription or their authorization for the HMO patients, but a prescription from your physician or nurse practitioner. And that we do the insurance verification, and we get you fully registered there. It can be mostly done over the phone. And then we set you up for your initial visit and all your subsequent visits after that.
And I think the important thing also to know is that, for those of you who watch, especially on Facebook Live and listening, Joanne isn't just an educator. I mean, you are one of the therapists that they're going to actually see.
Yes. Yes, I am. I am one of them. I'm joined
that
by.
Doesn't happen that often, right? You are actually one treating.
Yes.
You are in the trenches.
I am, and I love what I do, and I have great colleagues that I work with, and so if you get me or if you get my colleagues, you'll be well taken care of.
And I will assure our audience and the listeners today that we will. Once we have the information of when the clinic up in Santa Clarita here opens, we will make sure that we get that information out to our KHTS listeners, so that way they know that they have their options. And I think one of the big pieces that Holy Cross specifically has been involved with is making sure that we bring the services to our community, as opposed to the community having to travel for those services. And we see that with City of Hope. We see that with our relationship with Children's Hospital. And now we are going to see this with Oncology Rehab. Sandy and Joanne, thank you very much for coming out and joining us today. Oh, my goodness, the support group. Joanne, how do we get involved with the support group? Thank you.
So we are a full-service program, and so we even offer a lymphedema support group. Not very many of these types of support groups are around, and we meet every other month on Mondays from 4 to 5 o'clock in the Cancer Center at Providence Holy Cross Medical Center. Our next meeting will be on Monday, October 29, when our invited guest speaker, Bob Weiss, who is a lymphedema activist, will be presenting on appealing a denial of lymphedema compression garment supplies.
Perfect. Guys, thank you very much. Thank you for joining us on Providence Holy Cross Health Hour, and see you next month on KHTS.
They're at it again. It's yet another